Okay, good amount of people.
What time?
And
We got a couple more minutes.
2 more minutes. We'll let more people. I'm gonna probably start talking like a little bit after 6
Yeah.
or 6 MS Mountain Time, just so that. Because I know people come in a little bit later.
Is this one of the meetings like that? Does this meeting get locked? You know what I mean? Like if you're not in at a certain time, you can't get in.
No, I think you could join whenever.
Okay.
Yeah, anytime. I believe. I'm not. I don't quote me on that. I'm not 100% sure, but. People. Evan. Hi, Evan. Okay, it's 6.
Okay.
All right. I like the pineapple upside down cake.
I know.
Yeah. Hi, everybody. More people are coming in. Seems like it's starting to add up more. Ooh, almost 40 people. Pretty good amount.
$43.
I know, right? A lot. This is exciting. I love when people come. It brings me joy. It gives me serotonin.
I love it.
Yeah.
More of that.
Seems like, yeah, it's important.
Totally.
We are breaking barriers, y'all, by doing these Zoom panels.
Yeah, for sure.
Cool. Well, it's a little bit over 6. I think that it's probably good to start. I'm gonna stop sharing my screen. Hello everybody. Thanks for coming, and thanks for the 2 people that are coming to talk today. I really appreciate both of you and all the work that you do for Plume and the community and all the good things. But happy Trans Awareness Week. If you're new here, welcome to our 3rd Plume community, all about tea. Plume is the first trans-founded gender-affirming healthcare company by trans people for trans people. We offer gender-affirming estrogen and testosterone therapy from the convenience of your smartphone. I'm Sochi, and I help lead the Community Collaborator program, our brand ambassador program that amplifies the incredible trans leaders in our community. Tonight, we're excited to welcome Alex Guerra, Community Collaborator and Plume patient, and Dr. Alann Weissman-Ward, Plume doctor and provider, for an in-depth and fun discussion about testosterone-based gender-affirming hormone therapy. I'm so excited to be here and see y'all talk and listen to everything that's going to be said tonight. I'm super excited. Yeah, and then just a little bit on a note about we did a collaboration with Goodrx. This November, Plume collaborated with Goodrx in a clinical blog by Dr. Jerica Kirkley about gender-affirming hormone therapies, estrogen and testosterone. If you don't know what Goodrx is or who they are, what they do, they're a company that offers discounts on medication, making them far less cheaper than what they normally would be, and you don't need to insurance to use it. A lot of our members and staff use Goodrx, and we really love it. Love it here at Plume as an option. In this article, Dr. Jerica shares the difference between all forms of estrogen from injections, pills, and patches, and like what to expect when you're on estrogen or testosterone. Our Plume chat moderator, our Plume chat moderator will share more in the info box or in the chat box. And yeah, and so I'm gonna pass it down to Alex, and good luck, y'all. Thank you so much for coming. I really appreciate both of you, and thanks for everybody that's listened to me. I'm gonna head out, but thanks, y'all.
All right, thank you so much.
Yeah.
So hello, community. Thank you so much for coming tonight. I'm super excited. This is my first one, so bear with me. But I'm Alex. I use he, him pronouns, and I am a new community collaborator with Plume. And coincidentally, I'm also a patient of Plume's, which is awesome because it's been the best experience I've had with hormones, and just it can be really complicated. So they make it super simple. And today we're hosting a discussion with Dr. Alann Weissman-Ward, a Plume provider. And we'll be answering questions from the community. And at 7:30, we'll be opening up for a live Q&A, which is super exciting. And so, yeah, I'm so happy to be here tonight and to have this dialogue with one of the co-founders of Plume. So a little bit about Dr. Alann. He is a Jamaican and Jewish trans man who has been working in gender-affirming care for over a decade. As a provider or coworker, there's no one more generous with their time and attention than Dr. Alann. As an out trans man, he's personally aware of how life-changing gender-affirming care can be. He brings his warmth and his wealth of experience to every appointment, and he will work with you to understand your goals and provide you with the support you need to make informed decisions. So, Dr. Alann, we're so thrilled to have you with us to answer any and all questions about tea that we can fit into this hour. So yeah, anything you want to share before we get started?
No, I just thank you for that, Alex. Just one clarification. I'm not one of the co-founders, as much as I wish I was. I'm so glad I get to work with the co-founders. I am one of the early providers to start working with Plume. Yeah.
Awesome. Cool. So I guess we can get right into it because there are plenty of questions, which is awesome. Thank you to everyone that has asked some questions, and we'll be taking more later. So let's start with just like general changes. And some of the first questions is, what does it actually feel like in your body when you start taking tea? And does it hurt to take tea?
Yeah, that's a fantastic question. Start with the second question first. Does it hurt to take tea? If you're doing gel or patches, no, absolutely, there's no pain. If you're doing injection, for sure, you are piercing your skin with a sharp needle. So there's bound to be a bit of pain. It's nothing usually extreme and doesn't like a quick poke. Sometimes folks have a little bit of a lump after they inject, and that can be painful for a couple days, and usually that goes away. And as far as what it feels like in your body, I mean, everybody's different. Everybody responds differently. I think for me, and Alex, I'd definitely like to hear you too. Like for me personally, it felt like I was on the right operating system, right? Like the coding was right. I was on the right track.
Right.
Things made sense, right? And so that's a very general sort of abstract feeling, if you will.
Yeah, totally. I totally hear that too. Yeah, it was just like, it felt right, I guess. In terms of physical feelings, like right after a shot in the beginning, I used to have like a lot of energy, which was really exciting. But yeah, it's just like you said, being on the right track. Okay, so the next one would be, what are the requirements and process or way to achieve approval to get on tea?
So that's a great question. Here at Plume, we use the informed consent process. which means that you understand fully what all the reversible and irreversible effects of testosterone are, and that you have a history of gender dysphoria that's lasted for more than 6 months. And so that's how we do it here at Plume. Other places may ask that you see your therapist for 6 months to a year before they'll prescribe any testosterone for you. However, we don't do that at Plume.
Which is awesome. Okay, so let's move on to like physical changes. One of the questions is there a link between any chronic illnesses and taking tea?
So that's a great question. The short answer is no. And it's a bit more complicated with that. Folks who are taking tea long-term can definitely see changes in their cholesterol, for example, some changes in insulin resistance, and potentially increased blood pressure. Now, what the studies have looked like, while those changes have happened, they haven't had any long-term impact on what we call mortality or morbidity, which means, no, you're not necessarily at higher risk for having a stroke or having a heart attack, for example.
Okay, that's actually good to know because I always I always wonder that myself. How do you treat acne caused by gender-affirming hormone therapy?
Yeah, so the same way you'd treat acne caused by anything else, right? You sort of look into like, what are you eating? A lot of times, sometimes food will actually cause worse breakouts, and then there's always medications to treat it. There's prescription medications, there's over-the-counter medications, and that can run from a topical antibiotic solution that you do daily, and some folks actually will take a antibiotic by mouth daily. So it just depends on how severe the acne is.
Okay. This is an interesting one, which I get questions about sometimes, but will my chest get smaller before surgery? Is my bottom area, these are kind of in the same question, but is my bottom area supposed to hurt and grow?
Yeah, so let's answer, is your bottom area supposed to hurt and grow? Yes, it does grow. That's absolutely one of the irreversible changes when you're on testosterone. Can that be painful and uncomfortable? Absolutely. It is a sensitive area that has a ton of nerves in it. And if you think about anytime anything grows or swells, like if you have a little lump here for whatever reason, and there's some swelling there, that hurts, right? It is temporary. It does go away. It's easily relieved by wearing loose clothing. I usually recommend, like, if you're a hardcore bike rider, you probably want to hold off on biking for a bit. So that area is less sensitive.
Right.
And as far as the chest getting smaller before surgery, it really, really depends on what your chest size is pre-T. So, standard rule of thumb, right? If you're B, C cup or bigger, you're probably not going to see much change in the chest area. Potentially, if you're a smaller size, you may see some change, but not always. And remember, it also depends on what your body fat is, right? So if you're like down to a very low body fat, all the fat, including some of the breast tissue, may be decreased. But testosterone as a whole is not necessarily going to cause a significant change.
Right. So a more broader question, what should I expect to change and on what timeline?
So that's a great question. And again, it varies from person to person. For sure, changes that people will see. Let's start head to toe. And it depends on how long you're on it. A receding hairline, you can lose some hair. Facial hair, increased body hair, voice deepening, bottom growth, increased muscle mass, coarser skin, increased libido and increased hunger and increased mood. And I would say, as far as like how quickly those things happen, like one of the first things, you actually get hungry. Like that usually happens like a couple hours after your shot. And even if you've been on it for a while, usually when it's shot day, you're probably going to eat a little bit more. And then people's mood and libido goes up from there. And then it's sort of, everybody's different as far as what's next. Is the voice going to drop first? Is some hair going to come in? Bottom growth can happen pretty quickly. And then I didn't talk about this also, menses. So people's cycles will stop. And that can take anywhere from 3 to 6 months for that to stop.
Cool. So this is an interesting one. We kind of talked about how you know, it does deepen your voice, but someone asked, will I still be able to sing after I take tea?
Yes, you will. And your vocal cords are now going to be shaped differently. So you are absolutely going to be learning to play on a new instrument, right? Like it's a clarinet versus a saxophone. So you can sing. Is it going to be the same? No. Is it going to be a learning curve? Absolutely. And can you still sing? Absolutely.
Right. Cool. This one's interesting. What is one thing you wish you knew or someone had told you before starting tea?
That's a great question. What did I wish I knew before?
I don't know. I'm trying to think myself.
So I was one of the DIYers. So I was whatever, right? Like, let's just get this going.
Yeah.
Which I do not recommend to anybody at all. It's not safe. So I think I wish, I wish I had a provider who I could have worked with safely to start this medication with and sort of not felt as lost, like, you know, a boat sailing to sea and not knowing the navigation, not knowing the ways. So for me, that's a big thing. I wish I'd had some support.
Totally. Yeah. Yeah. I was thinking like, I guess maybe the emotional changes. I guess I wasn't like super prepared for how, like, since you do a shot, or I do personally do a shot, like it like weekly, it'll like, I'll see myself just go like this, which has been awesome to work with Plume actually, because I speak with Dr. Tony, who's awesome. But they were kind of helping me with like, maybe we should do it one day sooner so you don't get like that down curve. And I guess, yeah, that I was so interested in like, what's going to change. Like, I'm going to look like this and I'm going to grow a beard or whatever. And then, you know, the emotional changes, I'm like, whoa, there's a lot there.
Yeah, definitely.
Let's see. So these next questions are kind of surrounding age. Someone asked, are there significant differences in the way tea affects people according to age? Someone said, most of the trans guys I've met are in their 20s. I'm in my 40s. I don't know how closely I can compare their experiences to what I would be in for.
Yeah, so that's a great question. And no, right? Tea is going to affect your body in the same way as a 20-year-old. So yeah, there's not, you know, the one thing is folks who start testosterone later on in life may grow less hair, facial hair, but other than that, there's not any major changes or effects.
Cool. So someone said, I'm 56 and past menopause, wanting to start testosterone as soon as I can afford it. I've heard that age-wise, being in one's mid-50s is certainly not too late to transition. And that being past menopause is actually helpful in the process. Is that correct? And what should I expect to prepare for?
Yeah, so it's totally correct. It is never too late to transition, whether you're 56, 60, 70, 80, right? Like it's never too late, withstanding that you don't have some chronic medical conditions that would prohibit you from doing that safely. So, you know, for sure, once I think you don't have estrogen running through your body, you don't, and you're not having cycles, right? You're not necessarily titrating the testosterone specifically to stop cycles. So I'd say there's potentially a little bit more room there or some flexibility for dosing. Otherwise, I think you would prepare the same way that a 20-year-old would prepare, making sure you've got a provider who's supporting you well, making sure you have family who's supporting you well, and move forward.
Cool. Definitely. Are there any negative effects to having testosterone intake stop your menstrual cycle at any age, but mainly younger? I'm 26.
Yeah, so no, there's not. There's no negative consequences. And if you think about it, there's plenty of folks, cis and trans, who are not having their cycles for years and years and years and years. And we know there's not any negative effect, right? You think about folks who get pregnant over and over and over again, they're not having their cycles potentially for 10, 15 years. And we know there's not any negative health detriments. Same for testosterone. For not having your cycle for 10 plus years, there's no negative detriments.
Okay. I guess I'm going to bring in a personal question really quick because it kind of ties in, but um, is a hysterectomy ever like necessary if your cycle has stopped?
Yeah, so yes and no. If your cycle has stopped and you're doing perfectly fine, there is really no risk. There's no reason to get a hysterectomy.
Okay.
Some folks do have like pelvic pain and cramping, especially later on, if potentially being on testosterone for longer, and may want to get a hysterectomy for that reason, or folks who are having some dysphoria
Sure.
want a hysterectomy. But otherwise, there's no studies that say, hey, have a hysterectomy because it'll prevent you from like ovarian cancer or uterine cancer or endometrial cancer.
Okay. Yeah, that's what definitely.
Yeah.
Okay. So there's more. Another group of questions is going to be about mental health and like risk factors. So the first one, which we've kind of touched on, is does or can tea change your mood?
Yes and yes.
Yeah.
Yes and yes. It does, and it can, and it will. It can help alleviate anxiety. It can help alleviate depression. And I think for when it starts to alleviate, part of it's when it alleviates the gender dysphoria, we see some of that anxiety and depression get lifted off. Not all of it, of course, but it potentially now gives you more room to work with that anxiety and depression because you're not so bogged down dealing with the dysphoria, right? And it can definitely make you, it can make you have more energy. It can make you feel a bit more impulsive. I think it can definitely make you feel a bit quicker to anger. And I say that quicker to anger, and it does not necessarily mean you're going to react to that, right? So this roid rage, no, it's not really a phenomena. Will you experience anger quicker? Yes. Do you have complete capacity and capability of not flying off the handle? Absolutely.
Right. Yeah. I think that I was going to touch on that too, because there's this like misconception that you're going to be this aggressive person. And even I had that, like, I was kind of scared of that in the beginning. I was like, oh my gosh, I'm going to just be like this angry, like monster or something. But I will agree that I'm way more quick to anger, which I'm working on. I always suggest like mental health is super key, I think, for a lot of folks, especially
Absolutely.
for me.
Yeah.
But yeah, just keeping that in check, because I think just like frustration, I get easily frustrated. But also I think it's important to say that like I was probably had those tendencies before. It's not like all of a sudden I'm like that.
Yeah.
I definitely have those tendencies. They just may be a little bit exacerbated.
Yes, absolutely.
So it's nothing, I think people kind of have a fear of that, but it's nothing that is going to be out of this world.
Yeah, you're like you're not going to turn into Dr. Jekyll, Mr. Hyde, right? Like that's not going to happen unless withstanding you have an undiagnosed mental health condition that's unstable, in which case we're going to be working on that first before we actually give you the testosterone.
Totally. Cool. And then could you discuss, honestly, I don't even know how to say, is it cypionate or cypionate?
Yeah, cypionate, yeah.
And then versus enanthate?
Enanthate, yes.
Okay.
We all got to say it multiple times.
Yeah, I'm like, I don't.
Yeah, so they're really, really, really similar. The big deal is cyp or cypionate is much easier to get in the United States. It's just stocked everywhere. There's like one little change in one of the carbon molecules that differentiates the two. There's some studies that looks like maybe enthate is a bit quicker acting, and so not quicker acting. You will metabolize it quicker. So the half-life of it is shorter. Those studies are sort of like, really, but they're the same. Some people tolerate one better than the other.
Okay.
And I can't tell you why we don't have those studies.
Interesting. Okay. I had never even heard of enanthate.
It's not commonly used because it's just not manufactured in the same way.
Got it.
Yeah.
Okay. I actually got this question the other day and I didn't know how to answer, but do you have any advice for folks microdosing? Let's start there because
go for it, do it. I think one of the things is to be aware that you can microdose with gels, you can microdose with creams and injections. I think probably for folks who want to go very, very low on their dose, the easiest thing is to find actually a compounding pharmacy who can then compound you a microdose of testosterone that you're not necessarily going to get with the, again, big pharmaceutical companies that are manufacturing like androgel or testin, like those medications. So the easiest way to microdose is to find a compounding pharmacy to get that made for you. You can do it with injections. I would say that the amounts that you're injecting, it's a bit more difficult to do because it's such a small amount. And some folks just feel like, well, is it worth doing that small amount of injections? For some folks, yes, some folks, no.
Right. Cool. So what effects can one expect as they tweak their dose? And then kind of in the same question, it's what kind of effects tend to come at lower doses or higher doses, and how does this vary between individuals?
Yeah, I mean, I think it depends on what dose you're starting off on. You know, if you're at a lower dose and you increase it, if your cycles are still happening on your lower dose, they may stop when you're on a higher dose. As far as effects, and so let me step back. And also, if you're at a low dose, you may find that your energy is not quite right, and you're a bit tired. And so you may find like increasing your dose actually is giving you the right energy, and you're no longer having these like severe drop-offs of testosterone and have a more stable level, because that's exhausting.
Yeah.
And then the other question,
I guess what kind of effects come at lower doses versus higher, but I think you touched on that. And then just how does it vary between individuals?
it varies completely. Everybody responds really differently. All of our biochemistries are different. Some person may, you know, need 100 milligrams of testosterone, and I'm just using this as a marker for menses cessation or for the period stopping, and other people might need 50, right? Everybody's really different.
Cool. So we kind of talked about this, but are there any long-term health side effects? Anything our doctors should be especially looking out for when on T?
Yes, absolutely. So you definitely want to be looking out to make sure your red blood cells or hemoglobin and hematocrit are not too thick. You can get something called Polycythemia Vera, which is where your blood cells get too thick, and that can increase your risk for like blood clots and strokes, right? So you definitely want to monitor that.
Yeah, my cholesterol has definitely gone up since.
Yeah, and you can see some cholesterol markers change. Again, with the cholesterol changing, are we necessarily seeing long-term complications from that? No.
Right, which is good.
Yeah.
So this is a common question. What changes are reversible and what are not?
That's a great question. It's something like at Plume, we want to make sure that you absolutely understand what's reversible and what's irreversible. So the reversible changes, and everything, again, I say this with a caveat because it depends on how long you're on the testosterone for, but reversible changes can be facial hair, muscle mass, body hair, the fat redistribution, increased libido, increased energy. All those things can be reversible depending on how long you're on it. If you're on testosterone for a year, 2 years, your body hair will never go back to what it was like pre-T.
Right.
It's just something to be aware about. And the irreversible changes, bottom growth, voice deepening, and then we counsel that fertility can absolutely be an irreversible change in a lot of folks.
So this one's, we kind of touched on it too, but I think people really want to know this is like, is it possible to take testosterone without ever needing to go near a needle?
Absolutely.
But this is for injections or blood draws.
Oh, no, not yet. Not yet. Maybe in 2025, we'll be able to have like, who knows, a finger prick where you can check your testosterone level and check your red blood cells, but we're not there yet. So you absolutely do need blood work if you're going to be on any form of testosterone.
Right.
And that's to do it safely, which is what we want to do.
Right. But for the actual testosterone, there's the gels and gels and creams?
Gels, creams, patches.
Oh, there's patches. I didn't even know.
Yeah, yeah.
Cool. So we're kind of like right on time. We can, if everybody's ready, we can get into the Q&A questions. Let me see here. Okay. So we'll start with some of those. Let's see what. Advice for preteen nerves.
Oh, they're going to be there. They're good. They're going to be there, and it's normal, right? And I think sort of sitting with yourself or sitting with a loved one and talking through it and talking through like, what am I nervous about? And I think that can be really, really helpful. If you're nervous about like the injections themselves and the pain, there's actually this really neat thing called a shot blocker, which is this little rubbery thing you put on your thigh if you're doing the intramuscular injections, and sends a message to your brain that, oh, I feel this little rubbery thing and not the injection. It's like sort of a switch and bait, and it works really, really well. Yep. So that's, yeah.
Cool. Yeah, and yeah, just to reiterate that it's super normal. I think sometimes I get these messages from people that are like, people tell me I'm not trans because I'm nervous. And like, I think that can be a really like detrimental idea to spread, because it's a big change. Even if you're excited, it's such a big change.
It's a huge change. Yeah, it's just like you're gonna get the pre-jitters when you start a new job that you love, or you're about to go on a date that you're excited about, right? You're nervous, and that's a normal part of the human existence.
Yeah, totally. Okay. Interesting. So when and how did you know absolutely that tea was right for you? Do you have advice for someone who's still in the process of making that decision?
Yeah, and everybody's different. So for me personally, I sat with it for a long time, and until I was ready.
Yeah.
You know, I reached out to a couple of my friends and I said, look, like, I asked them, how did you know you were ready? And one of the things they said, I was like, look, if it was, and this is it's fantastical, but if you were in a bubble living your life exactly how you wanted to live, what would you do? Yeah. And that sealed it for me, right? Which is, it sealed it. And I was like, yes. I mean, again, I probably sat on it for close to 10 years before starting hormones.
Yeah, it's so funny you say that, because I did the exact same thing. I asked myself, if tomorrow I could wake up and start testosterone and no one would bat an eye, like it had nothing to do with anyone else, would I do it? And it was like an astounding yes. So, yeah. But yeah, I sat with it for a long time. Obviously, I researched it, and I, you know, had to sit with like what is not gonna, like what's irreversible, what's, but once I asked myself that question, I just knew. But it'll definitely depend for sure. Okay, dosing. Someone said, what do you mean by a low dose? What's a low dose and a high dose of tea?
Yeah, so it's microdosing, low dose, and then let's moderate and high dose. And so microdose is going to depend on what form we're using, right? But we'll talk about the injections, because they're probably the most common form. You know, say a micro dose of injections would be like 10 to 20 milligrams, even less, once a week, which is a pretty small amount to draw up from the testosterone. While again, if you can find a compounding pharmacy who does compounding testosterone and will come up with a different doses, it's a bit easier. So low dose might be around 30 to 40 milligrams. And then a moderate dose, maybe 50 to 60, and a high dose, maybe 70, 80, 90, 100 plus. And again, all that said, everybody's body's really, really different. And so what may be high for one person is not high for somebody else, right? Somebody may be on 140 milligrams, 160 milligrams once a week, and that is the perfect dose to keep them in range. Where for somebody else, that's going to throw them way, way, way out of range.
Right. Cool. So I guess kind of goes with what we just talked about. I should just put them together. But what can you expect from long-term low T usage, 1.5 to 2 years plus 0.2 mLs once a week?
Yeah, so, again, it depends on how your body specifically metabolizes the testosterone. And I would expect to see effects like masculinization effects. So eventually, yes, your voice is going to deepen. Yes, you're going to have bottom growth. Yes, you're going to have some facial hair, some increased muscle mass, libido changes, and some mood changes.
It'll just be maybe like a slower, gradual process.
Yeah, it may be slower, and you may not reach, you may not, again, everybody's body's different, but you may not have as much body hair as, let's say, somebody who's on a higher dose for longer, or facial hair.
Right.
And that's, again, I sound like a broken record. Everybody's body's different.
Yeah, of course. So someone said, can you go on a lower dose of tea to avoid a changing deeper voice? I want to go on tea for multiple reasons, but not because of my voice. Wondering if there are any possibilities for accommodating for that.
So, the short answer is no. Like, I would expect to have some voice changes. And I guess I would wonder, like, what other effects are you looking for? And are there other medications that may do a better job?
Okay, interesting. Okay, let's see here. Oh, this is interesting because I also get this question a lot. Can you go over the differences and misconceptions surrounding IM versus sub-Q injection methods? Specifically, can the testosterone oils prescribed for IM be readily used for sub-Q? I've had a lot of medical professionals offer contradicting information, and same here.
Yeah, so yes, you can use the exact same formulation to do the intramuscular, which is what IM stands for, or shot into your muscle, versus a subcutaneous shot as a shot into like the skin or fat in your stomach. You can use the exact same formulation for it. There's one study that looked at the absorption rates are exactly the same. You'll get the same level of testosterone, whether you're putting the shot into your muscle or the shot into your into the skin. And it's really a matter of personal preference.
Right. Yeah, I hear that a lot where like, oh, intramuscular is faster or like all that. And I never know if that's true or not.
So no, no.
Yeah, that's what I figured. Oh, this is good. Any advice on how to properly dispose of the needles?
Oh yeah, absolutely. You can go to any pharmacy and ask for a sharps container. These funky little red things with a white top. And you can put the needles into the sharps container. You can throw the syringes, so the needles, if the needle comes off the syringe, which it should, the actual syringe, the tube, can go into the garbage, the regular trash, and then the needles can go into your sharps container.
Oh, darn, I've been putting the whole thing in there and now it's filled up.
Yeah, I did that for a long time. I was like, wait, I don't have to do this. It saves the space in the sharps container. Yeah.
No, I'm gonna stop doing that and it's funny, I actually, the day I started, they didn't have like the sharps container. So I bought like, it's this jug for like juice, but it has like a perfect little top and everything. And so it was a cheap option. It was like $1. So
perfect.
Anything not gonna poke anyone else or.
Yeah. And you can bring it potentially back to the pharmacy and they can dispose of it. Sometimes your local clinic can take it or like a hospital.
Yeah, that was gonna be my next question because I didn't know where to, still don't know. But yeah, I'll probably take it to the hospital or something. Okay, let's see, what else is on? So I'm scared of needles. Will the gel, pills or patch offer the same changes, or are they different for each one?
Yeah, great question. So the testosterone does not come in oral pill form. So as far as the gel and the patches, yes, you'll see the same changes. There's some thought that it can potentially take a little bit longer to see the same changes as if you were doing the injections. I would say the one like major advantage of the gel or the patches is that you're getting a much steadier state of testosterone in your blood, and so you're not having these like ups and downs like you will with the injections.
Okay. And why, uh, maybe it's an ignorant question, but why haven't they come out with pills like for us? Like estrogen has pills, right?
Yeah, they do. You know, if I'm like trying to do my medical history, I believe they had testosterone pills like maybe 60s, 70s before then. And I think what they saw with them was a ton of liver damage when you
Oh,
eat them, because the testosterone gets metabolized by the liver a lot, and that it just wasn't doing any good. Don't absolutely quote me. I feel like I just pulled that somewhere in the recesses of my brain.
sounds right to me.
I can get back to you with more information.
Okay. No, yeah, I've always been interested because that would be so easy.
Absolutely.
I
And
would love.
other countries, they actually have like longer acting forms of testosterone where you can do a testosterone shot like every 3 months. I think it's over in Europe and Australia. We just don't have it in the United States.
Yeah, I've seen that, and I was like, dang,
Yeah.
I'm gonna get it over here. Um, okay, this is good. I actually have questions about this. This is gonna be about like fertility. Um, so pretty much first question, can you explain more about long-term changes related to fertility?
Yeah. So long-term changes is your basically your cycle will shut down and eventually you can stop ovulating, right? And we think that can then potentially cause you to never be able to ovulate again or to produce eggs again. There's a really small sort of like what they took, like they looked at about 10 non-binary trans masc folks on testosterone. And they've been on, I believe, like testosterone for 1 to 2 years. I mean, they looked to see like, and they wanted to get pregnant, and they looked to see how do they do getting pregnant. And I believe half of them, you have to stop the testosterone to
Yeah.
start ovulation to see if that will start. Half of them had to go on to another medication to induce ovulation. So like a fertility medication, so like another shot, another hormone basically. And I think the other half didn't. They just started ovulating right away. That being said, like the surefire way to make sure you can preserve your fertility is to freeze your ovaries, which still may involve taking another medication so that you can produce a lot of ovaries so that they can go in and grab a bunch.
Okay. Interesting. So yeah, next question is pretty much, is it recommended to harvest eggs prior to starting T if you want biological children? Can you, do I need to freeze my eggs?
I think if you are 100% sure that you want to have children in the future with your own genetic material, yes, freeze them before you start testosterone.
Yeah.
If, right, and then again, there's always an if. If the weight of the gender dysphoria is sort of out, if it's too heavy, like that is taking precedence, then and that's going to be improving your mental health, then do that first, right? So it's a balance.
Yeah, totally. I'm definitely in that boat where like I was just too excited. And I mean, yeah, there's a possibility that you can like stop and see if you can ovulate again, then freeze those. But yeah, but now even like thinking about stopping for a while, I'm like, yeah, I don't need to have them biologically, I guess.
Yeah, it is a big deal to stop and go off fatigue and go on these other medications for sure.
Totally.
So I think mentally, maybe again, if you feel like you can hold off on starting testosterone and that preserving your fertility is better, that mentally it's potentially going to be better to do that first, so that again, you don't have the up and downs of pretty big hormonal changes, and that your mental health can stay a bit more stable.
Yeah. Someone said, hi, I'm wondering if Dr. Alann can talk a bit about atrophy and people needing to get hysterectomies after a certain amount of time on T. I feel like there are some scary myths about this floating around.
Yeah, so you can get vaginal atrophy for sure. And that's a pretty easy cure. You can get some estrogen cream and use that, and that can stave off the atrophy. So some sort of signs of vaginal atrophy can be thinning of the lining of the tissue there. Maybe it's going to bleed a bit easier, potential dryness, and that's easily solved if you do not want to have a hysterectomy. Well, a hysterectomy is not going to solve that, for starters, right?
Right.
It just doesn't. And if you're having vaginal atrophy, you can use estrogen cream. I think there was a thing about Buck Angel having some atrophy that turned into some kind of sepsis. I have no idea what happened. I've not really heard of that happening before.
Yeah. Okay.
Yeah.
Interesting. Okay. Can you talk about chest feeding after being on T?
Yeah. So you can still, as if you're on T, it's definitely going to be harder to chest feed, for sure. That being said, you may still be able to lactate. It's not guaranteed. I think if you do want to chest feed, like potentially you could switch to a lower dose of T and try to lactate, or stop the T.
Got it. Okay. Okay, a question about PCOS. Can I take T if I have PCOS or an autoimmune condition like hypothyroidism?
Yes, you absolutely can, for both.
Cool. All right, physical changes. What is meant by like body fat redistribution? Like the fat goes from where to where?
Yeah, so the fat may go, it can shift around in your face. It can shift around in your torso. So it may go from like your hips and your butt to your stomach. It can shift around on your arms. It can shift around in your legs, and it'll go to your stomach.
Yep, I have found that to be true. Definitely. Someone said, I've been on T for 5 years and I'm still dysphoric about my voice. I've done vocal therapy, but what are other options to deepen voices?
Yeah, it's vocal therapy, and you're probably where you're going to be.
Yeah, voice stuff is, yeah, it's tricky.
I believe probably somebody out there will offer a surgery where they can shorten your vocal cords. I don't know that there's many. They're called the ENT, ear, nose, and throat docs who are doing those. But that is always an option. And I don't think there's many surgeons doing that. But if you do want more information, you can just link up and we can find out who that is. Send the information to you.
Cool. I didn't even know they did that. That's awesome. Someone said, so this kind of goes back to like IM versus sub-Q, but is it true that intramuscular injections will result in greater muscle gains than gel or other means?
No, you'll still put on muscle mass, whether you're doing the injections or whether you're doing the gel. That being said, that you absorb the gel as well as you absorb the intramuscular injections.
Right. Okay. Going into gels and creams, with a cream or gel, can it rub off onto your partner and affect them? Is that true?
Yeah, it's definitely true. So the gel can take up to 3 to 4 hours to absorb into your body. It dries pretty quickly, but the absorption can take a lot longer. And let's say for whatever reason, you were out in the rain for 1 second, and then if you put it on your shoulder and you rubbed up against your partner or animal, like that may rub up against them. Absolutely. So it is possible. The risk, the overall risk is pretty low, and it's still possible.
Yeah. Is there any evidence that shows testosterone increases the occurrence of migraines?
Great question. Absolutely. Yes, there is. Yeah.
Oh, God.
Yeah, so testosterone can absolutely make some people's migraines worse.
Interesting.
Yeah, it can.
Okay. Yeah, I suffer from migraines. I don't know if I've seen an increase, but now that you mention it, definitely get a lot of headaches. How likely is it to lose your hair on T? And are there methods that make it more or less likely, i.e. injections versus gels?
Yeah, so everybody's different. Everybody's genetics are different. I've been, I've been on T for 10 years, and the thinning has definitely just started to really go, and that train is on. It's not going off track. Yeah, there's some medications you can take to help reduce balding or hairline recession. Those are medications like finasteride or dutasteride, the two medications. And you can always start that when you start your testosterone, especially if you are not really interested in having a lot of facial hair too, because that can help to reduce that. But those are two medications that can help with that. And there's always Minoxidil, the brand name for that we all know is Rogaine, so you can use that. There's also actually rosemary oil has been studied in comparison to the Rogaine, and they work just as well.
Really?
Yeah.
Cool. Let's see what's next. Okay, because of COVID-19 situation, there was a couple of days where I couldn't find my tea. Now I have pain in my stomach. Is this normal, and will this ever stop, or will this stop in a couple of months?
I get, so you can absolutely get cramping if your testosterone, like if you potentially like miss a shot or you go too long with your shot, you can potentially have cramping. I don't know if that's what you're referring to as far as your stomach, and that should go away once you sort of back on your regimen.
Okay. Cool. Yeah, so we touched on the finasteride, right? It can help with hair loss and receding hairline, correct?
Yes, and those are medications that we prescribe with Plume.
Cool. Okay. Mental health. This is very important to people. I have heard there can be a decrease in range of emotions. I'm curious what your personal and anecdotal experience is with this. Thanks. Plume is awesome.
Yeah, so personally, like, I guess I was never really that much of a crier. For that, I can't really tell a big difference. Maybe I used to cry a little bit more. For sure, actually, I find that like things make me, I get a little bit more verklempt or a little bit more choked up easily now. Like we'll be watching like a sappy story and I'm like, oh, like, so like I feel it more. Maybe that's the opposite of what other folks feel. Alex, how about for you? We're all different.
I was about to say I'm the exact opposite.
Okay.
Not getting too much into zodiac signs because I'm not even like really, but I'm a Cancer, and people used to be like, you are the epitome of a Cancer, like super emotional. And I honestly, it's almost frustrating, but like I cannot cry. Like I just, it would take so much for me to cry. And it's almost like, why can't I cry? But I think also like, it's getting a little better. I think in the beginning, yeah, it was like, for me at least, a total shift. And like, I just couldn't cry. I couldn't. I think maybe it was like more overshadowed by like a little bit more of the frustration, anger parts of it.
Mm-hmm.
I think those took a little bit more precedent, but I definitely have experienced like a shorter range of emotions, I think.
Okay.
But again, yeah, it's so personal. It's really interesting.
Yeah.
So there's how does tea affect your mental stability? And then in parentheses, it says for those who struggle with mood disorders.
Yeah, so a mood disorder can be anything, right, from anxiety, depression, bipolar disorders, which a lot of people deal with on a daily basis. And we definitely want to make sure that, you know, if your mood is stable. Sorry, that's
right.
So like, you know, I can't, like if you're in an acute manic phase, it's as if we're talking about, let's say, bipolar disorder, it's not a good time to start the testosterone, right? You know, if your depression is sort of so severe that it's putting you in the hospital, you know, if the dysphoria is really putting for a lot of folks, it is leading to the depression, they should probably start the testosterone in the hospital, right? Did I answer the question? I feel like I went.
I think so. No, definitely. The next one's interesting. Are there any side effects that you are aware of or difficulties for individuals wishing to start tea who have ADHD?
Yeah, so no, I'm not aware of any reason why testosterone would necessarily worsen or make ADHD better, other than this is sort of, again, I'm sort of reaching here, that like feeling, and this is ADHD has a different mechanism of action, but feeling more connected to your body is potentially going to make you feel more grounded, and that may in turn help the ADHD. Again, I have no research to back this up.
Yeah. No, yeah, actually from a personal, I was also diagnosed with ADHD, and I will agree that like for me, ADHD came up a lot in like anxieties and like, stuff like that. So it actually helped a lot, I found personally again. Um, that sense of just like, okay, I'm more at ease now and I can like focus better, I guess.
Right on. Yeah, that makes perfect sense.
But again, yeah, it's just from personal I don't know if there actually is any correlation, but I like to. Okay, I'm gonna try to get through more of these. Is it too late to take tea before top surgery? How will testosterone be produced in the future? Will it come in pen format for easier dispersion? I hope.
Oh, that'd be nice.
I know.
Yeah, I like that.
Yeah.
That'd be awesome. So the question is, can you take testosterone before top surgery?
Is it too late to take tea before top surgery? I'm not quite sure.
So you can take testosterone before, after top surgery, right?
Yeah.
Yeah.
I think that's what most people want to know. I get a lot of questions with like, I haven't started tea. Will they let me get top surgery?
Yes.
Yeah. Or
Yeah.
they should.
Yeah. In most states and most insurance companies will honor folks having top surgery without being on testosterone.
Yeah. I will
And
say,
yeah.
I have heard that Aetna, which is what I have, but not what I went through for my top surgery, they require a year, which is whatever. That's another.
Yeah, that's another. And look, there's plenty of non-binary folks who have, and trans mass folks and folks who have no intention of ever going on testosterone and still have a lot of dysphoria with their chest. And they are rightly allowed to have top surgery.
Absolutely agree. Totally. Can you continue your shot leading up to top surgery or bottom surgery? I had some surgeons said to stop shots, but my endo said it wasn't an issue. Ultimately, I didn't stop my shot cycle at all during my top surgery process.
Yeah, so that's a great question. There are a lot of surgeons who are going to ask you to stop your injections prior to surgery. And there's nothing out there that says you have to do it or that you can't be on testosterone during your surgery. So, there's again, for that, we have no studies that show being on testosterone while your surgeries is going to cause a negative outcome.
Yeah, totally. The only time I didn't do it was right after, because I was just like, so like it was the day, I think my shot day was the day after I got top surgery, and I was like, no,
yeah,
I'm too uncomfortable. Okay. Ooh. How does a person get around to proving they have gender dysphoria, a diagnosis? Can you talk more about Plume's informed consent model?
Yeah, so that's a great question. They're like, how do you prove that you're trans enough?
Right.
Or non-binary enough, right? Like, I think the way we do that is we have a discussion about what your lived experience has been, and how hormones will help you live the life that feels more authentic and more congruent to your identity, right? Again, like there's not this magic taster that like beep, you have gender dysphoria, beep, right? Again, it's a really personalized discussion that all the providers have with you at Plume.
Yeah, totally. Okay, this is cool. So this is about like partners. My wife is asking if there are any tips on best supporting a person's transition or a person transitioning.
Yeah, for sure. I should bring my partner in.
Yeah, I should too. Yeah.
I think she would say be patient. Your partner's about to go through their second puberty. And if you can recall what your first puberty was like, for most of us, it was a bit interesting. We weren't always the nicest people. We weren't always in our right minds, right? And we're learning how to be again in our bodies and our minds. So be patient, to me, would be the biggest advice to your partner.
Totally agree.
What do you think, Alex?
Yeah, patience, huge. And just communication. I like to think that like if you're in that kind of relationship, it's like a collaborative effort too. I found times where I also needed to communicate to my partner, like what's going on, because they're also, you know, you can support and listen. But I think for me, I felt like I also needed to give a little bit. So it's gotta, I think, come from both people, but definitely patience and just listening, just like being there.
Absolutely.
Without giving too much advice, just being like, yeah, you know, today it does suck. Yeah, like today was hard, or, you know, sometimes that's the best kind of support. Okay, advice for those transitioning while being in a relationship with a partner pre-T.
So is the partner pre-T or are you pre-T?
Transitioning. I think that the person is pre-T and their partner is not. Or no, wait, advice for, oh wait, someone's writing here. I think their partner is, I think their partner might be pre-T.
So I would exactly the same that we were talking about before. Communicate with your partner. You know, yeah.
Mm-hmm. Yeah. I myself was with my girlfriend before I transitioned, and still now. So I think that's always interesting. And I kind of just started like hinting and like, you know, like making little like weird remarks about like, oh, look at this trans, or like, I don't know. I don't even remember how it happened, but yeah, just kind of feeling it out too, because we want to make sure that everybody's safe in relationships. Super important.
Absolutely.
I mean, for some, they might just be like, hey, this is what it is. And that's awesome. For me, I found it helpful to like just make little hints and see where she was with that. And it obviously turned out for the better. But yeah, it can be hard to talk about. Someone said, great to hear about trans people finding love in affirming relationships. Totally. It's totally possible.
And it's really common. Like, I just want to say, like, again, like what a pleasure it has been through Plume to work with a community, and how many of the patients are so supported by their partners, are so supported by their family. It's astounding. And, you know, yeah, and it's awesome to see.
I agree. Yeah. Okay, we're getting down to the end here. A couple more questions and then we're done. Is there any low-key way to find out if my workplace is a safe space to start transitioning?
Yeah, I mean, you could always ask, if depending on how big your workplace is, like ask HR, the human resources, hey, can I see the employee handbook? And you could always see if they say anything specific related to gender, like we do not discriminate around gender. Or even like if, you know, depending again on the size of your company, the communicate to the human resources person, like, hey, like, what's your policy on this? And ask. And that's so sort of that's on the upper level, the administrative level. And I think like with your coworkers, you know, same like Alex, like what you're saying is like you want to like drop a hint here and drop a hint there and see what folks say and see people's reactions.
Yeah, totally. Yeah, it can be hard. I've always like worked in places that work with the queer community kind of for that reason, to like make sure that I feel supported, but of course not everyone wants to be in that. But yeah, dropping hints is always the best. And just knowing your rights too, like, and knowing that like you can't be discriminated against for that reason, but just know that places can say that and then still treat you differently, which is super sad and horrible, but you know, it's something to just think about. And we hope that doesn't happen, of course, but knowing your rights is super important.
Right. And the Supreme Court basically said you cannot discriminate based upon gender, specifically transgender identities at the workplace, right? So we do have these federal protections. That's a whole nother court case, legal case. Yeah, that we know that people have to potentially go down, and we hope that folks don't.
Yeah, totally. Okay, and then do you have experience with starting tea before coming out to some people? How long did it take before they noticed, and how did you approach that?
Yeah, for some folks, they want to start the testosterone before they're coming out because they're not, to them, it feels safer to come out actually when changes are happening, right? And it feels like an easier way to do it.
Yeah.
And so the question was about the timeline, is that right?
I guess, yeah, how long did it take before they noticed and how did you approach that? I mean, I don't have any personal experience, but.
Yeah, I pretty much, I think I came out to everybody. I was like, hey, this is what I was doing. This is what I am doing, I think.
Yeah.
It was a while ago, but yeah, like, some folks may be really astute and notice really quickly, like, hey, your voice is a little bit different or your mood is better. And other folks might not notice for 6 months to a year.
Yeah, totally. And then just any final words of wisdom for the community.
One, I'm just so glad y'all are here. I'm so glad that you've shown up. Alex, it is so good to be doing this with you. I think, again, just know that, like, we're here to offer a safe space, to offer gender affirming care to folks across the non-binary and trans spectrum. And we're here to support you.
Yeah, definitely. It's been such a pleasure. Like, this is so awesome to do. And yeah, it's just great to see people involved, and I guess just like doing these like makes it so much more like just normalized. And I think that's the path that we need to head to, like my big thing is like, I'm proud of being trans. And yeah, it's taken me a while to get here, but I'm super proud. And there's nothing that's going to take that away from me, and so I do a lot of work through social media to like make sure that other folks feel uplifted, and that being trans or non-binary or anything, like, it can be a beautiful thing at the same time. So that's for me, it's super important to make sure that people know that it can be a happy experience,
Yeah.
In the end of it. But yeah, so that was all the questions. Thank you so much, Dr. Alann, and all of the people that attended and the members for joining us today for All About Tea, and this week for Trans Awareness Week. Stay tuned for more information about upcoming Plume community events in a follow-up email tomorrow and next week. And then, of course, follow us on Instagram at @getplume to keep in touch. We'll be sharing the YouTube video tomorrow as well, so look out for that. But yeah, have a safe and peaceful night. If you have any more questions, please check out Dr. Jerica's recent article in our collaboration with Goodrx. If you're interested in testosterone-based gender-affirming hormone therapy, or you can always send us an email at hello@getplume.co. And yeah, if you're interested in joining our community collaborator program, check out the link in the chat. But that's about it. Do you have anything else?
No, that's it. Yeah, thank you.
Awesome. I hope everybody has such a good night. And yeah, this was super fun, and I look forward to more. All right. Cool. I guess that's it.
All right.
See you, everybody.
All right. Thanks, y'all. Bye.
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 Thanks, Alex. Thanks, Dr. Alann.
Yeah,
Yes.
thank you, Neva.
Thank
Everyone.
you. Good night, everyone.
Night.
All right, that's it. Yeah.
That's it. Yep. I'll close it off. But yeah,
Cool.
thank you. Thank you so much.
Did we really get to all the questions?
We got to almost all of them. Yeah.
Solid.
That was amazing. You were really, really incredible. Thank you.
Yeah, thank you, Nuba.
All right. I'll talk to you soon.
Okay, bye.
Bye.
Sorry, I accidentally left. My bad.
No worries. No worries. I'm just, making sure if everyone wants to say goodnight to each other,
Oh yeah.
share their
Say goodnight.
IGs.
Yes.
Thank you.
I hope that went well.
It was incredible.
Okay.
Absolutely incredible. Yeah. Fantastic job.
Okay, good. I've
Yeah.
never done this, but
You'll be back for more, Alex.
Yeah, for sure. Alex, I did peep your Instagram. It is awesome.
Thank you.
Right?
I
It is
appreciate
awesome.
that. I try my best. Yeah.
Yeah.
It's just yeah, it's been such a insane process over the just like, it started in the summer and then it just like went off and I was like, okay, I can get used to doing this. It's
Right
pretty
on.
fun.
Nice.
Yeah, so it's been a great experience. So I'm glad, and I'm lucky enough to work with y'all too on this, and I'm stoked.
Sweet. All right, I'm about to go to bed.
Yes.
All right. Take care, y'all.
See you. Have a good night.
Bye.
Bye.